Time now for Morning Rounds, our look at the medical news of the week with CBS News Chief Medical Correspondent Dr. John LaPook and CBS News contributor Dr. Tara Narula. We begin with two new studies out this week examining the role of exercise and nutrition in recovery from colon cancer. John looks at the details.
5 years ago, Dave Strong and his wife Mary decided to get in shape. They changed their diet and hit the gym 5 days a week. After turning 50 last year, Strong had his first colonoscopy.
The first thing I saw was my wife over me with tears in her eyes, so I knew immediately something was bad.
The bad news was colon cancer that had already spread to his liver. He's had 3 surgeries and is about to start his last 5 treatments of chemo.
I pushed myself when I could. I slowed down when I had to, but I tried to keep the normalcy going.
He continues to eat healthy and work out. New research suggests those kinds of lifestyle choices can help. One study followed patients with colon cancer who had completed treatment. Researchers scored them based on body weight, physical activity, and dietary choices. Those with the highest scores had a 42% lower chance of dying over 7 years. Dr. Charles Fuchs at the Yale Cancer Center co-authored both studies.
The diet probably changed your body's chemistry in a way that makes the growth of cancer far more hostile.
In another study, colon cancer patients who ate at least 2 servings of tree nuts a week had a 46% lower chance of relapse over 7 years. Tree nuts like almonds, walnuts, and cashews help control insulin levels, and it's believed insulin can fuel the growth of colon cancer cells.
By taking nuts, you reduce your risk of diabetes, and for colon cancer patients, you reduce the likelihood of the cancer coming back.
Wow, that's fascinating.
Isn't it?
Just fascinating. It's so interesting that we're not talking about pills here. We're talking about lifestyles, exercise, things like that.
And diet. And actually, these kind of studies don't prove cause and effect, but they do make sense from a scientific point of view. The thought that if you could drive down insulin levels in the body, it might make a difference.
Yeah.
I found out something I didn't know. In the lab, when they're trying to make colon cancer cells grow, they add insulin.
Wow. Interesting. Eat your tree nuts.
Yes.
Our next topic, vaccinations and international travel. Most measles infections in the U.S. are the result of travelers returning home to this country. A study published this week in the Annals of Internal Medicine looked at travelers headed overseas and how frequently they refuse vaccinations for the measles, mumps, and rubella prior to traveling.
The data included adults who visit a network of clinics that focus on international travel health. Over 6,500 people were eligible for the vaccine at the time of their clinic visits. However, over half did not get vaccinated during the consultation. Tara, what were the reasons for that?
48% of it was travelers refusing, mostly because of lack of concern. 28% was provider decision, saying they don't need it, usually, and about 24% were health system barriers. So, for instance, the clinic would send them back to their primary care to get vaccinated. I think the biggest issue is really educating travelers that this is a travel-related illness. I don't think that people think about measles, mumps, and rubella as something that they could get abroad. But in fact, measles, for example, has been eliminated in this country since 2000, but we still have outbreaks. These outbreaks, if you trace them back, they are coming from an imported source. Over half of these cases that are coming back are in U.S. travelers who were unvaccinated. So very important to get that word out, important to get these vaccinations before you go abroad, especially not only to protect your own health, but those in this country who don't have the immunity to fight off, so they're immunosuppressed, or babies, for instance, who are too young to get vaccinated.
John, did the study drill down into that resistance and how to convince patients?
Yeah, well, Tara mentioned most of it. About 3/4 of the people just were not concerned about the illness. It's no big deal. And it's true, measles can come and go, but it can also cause serious problems like encephalitis and even death. And as Tara said, even if you're not concerned about yourself, you have to be concerned about the other people. And you said it beautifully, which is you can bring it into another community. That's what just happened in Minnesota. Somebody came back, possibly, but somehow there was a group of people there who were unvaccinated and they got the measles. There are people who can't get it. And again, I go to the baby. You don't get the first shot until you're about 12 months old, right? So what happens between then and birth? you can get it if somebody comes back carrying measles.
What are the current recommendations, Tara, if you're traveling in terms of the vaccine?
Yeah, so the CDC has a website. They do have recommendations, and that is essentially that for teenagers or adults who do not have immunity, they should get 2 doses of the vaccine separated by about 28 days. So to know if you're immune or not, if you have a blood test that shows antibodies, you would be immune. If you were born before 1957, when there were lots of measles cases, you would be immune, or if you've already had measles, for instance. When it comes to infants, if you have an infant and you're going to travel before they're 1 year old, they should get a shot between 6 and 11 months, and then 2 more doses after the age of 1, again separated by 28 days. You know, this is a very infectious disease. If people are not immunized and they're exposed, over 90% of them are going to get this infection.
Wow.
And the vaccine is very effective, 97% effective against measles, about 88% effective against mumps.
Finally, quitting smoking can be a major challenge, but a little encouragement can go a long way. A new study by the American Cancer Society looked at the role that emails can play in helping people quit. The study included around 1,000 smokers who were planning to stop. It found that the group that received the most personally tailored emails had the highest abstinence rate, followed by those who got the second most, and then those who received only 1 non-tailored email. So what I'm learning from this, Tara, is stay in touch with your friends who are trying to quit smoking.
Yes, you know, I think they comment about how it's that personalized messaging that makes you feel like somebody cares, that somebody wants you to succeed. And we know that just in general, people who tend to be married, who have strong social support systems, there are studies that show they live longer, they have less cardiovascular disease. So that network of support, even if it comes in the form of an email, is important.
I'm wondering what the typical email is supposed to say.
Well,
don't give up.
Yeah, and I think that
no surrender.
The technical medical term for what you need in your life is a nudge.
Nudge.
A nudge works. Well, community helps
Yeah.
for all kinds of health outcomes, right? Drs. John LaPook and Tara Narula, thanks as always.